so this is for discussion number 5. For the first question, Teresa's personal history as a former professor, I think that this helped her handle the demands that she faced in responding to the distress of Mary and her family during this process. I think her history as a professor enabled her to explain things to the family about what was going on in the process of Mary dying and why the care team was doing what they were doing. For example, she explained to Mary's family why she had on the breathing mask and how that helped her get oxygen into her body and deal with the respiratory distress. Another example is when they were helping Mary pass away, and she explained to the family why they were giving her morphine and what that morphine would do and when she was giving it and why she was giving that and how that was going to make Mary's passing more comfortable for her. And finally, Mary's family asked about why her body was jerking and she was grunting, and if that was Mary herself or if it was just her body. And Teresa was able to explain this to the family, not to be alarmed that this wasn't, Mary struggling. It was just reactions from her body. I think personal skills that Teresa had that made her equipped to be spiritually healing for the family was that I think something that was interesting to think about is that she was a new nurse. She was still in training. So I think the more experience you have as a nurse or in the healthcare field, I feel like you kind of get burnt out because she had, they have so many patients and they just, after a point you just get kind of callous to what's going on because you see it every day. But Teresa was still new and she was still really compassionate and really determined to make a difference as a nurse. Another personal skill I think she had was that she was a good listener. And an example of this was when she was talking to Al in the kitchen, and Al was really expressing his frustrations with Mary's primary oncologist. And Teresa just kind of didn't say anything, just let Al talk, and she kind of just let him know that he was being heard. And sometimes that's better than, saying anything. Some examples that Teresa intentionally engaged in opportunities to support the family was, I think, firstly, when Mary was in the code situation and the nurses and doctors didn't want her to do anything. So the way that she could contribute to that situation was just smiling at Al and making him feel more at peace during that situation. Next, she really took on the responsibility of finding a priest for the family to perform the last rites. And her preceptor nurse was saying, just give that responsibility to the unit clerk. That's not in our job description. But Mary had told the family that she would find a priest, and she took that seriously and really went above and beyond to find that priest because she knew that was, something she could do and something that was important for the family. Nextly, I think that she was able to read between the lines. The doctor and the nurse said that they had to wait for the family to come to them to explain the options they had for Mary. And the family didn't literally come up to her and say, hey, we're coming to you to find out the options. But they were confused. They didn't know, what the process was. And she kind of read between the lines that, this is a family asking for help and asking for the options. And finally, I just want to touch on again that she intentionally engaged in these opportunities by explaining to the family, because it doesn't say in words in the nurse's job description that you have to explain things to the family. But she just kind of, again, went above and beyond to make this experience more peaceful and smoother for the family. Okay, moving on to the second question. The recommendations that I think were most important, particularly in the story of Teresa and Mary, was 1C, which says all team members should have knowledge of the options for addressing patient spirituality, including spiritual resources and information. So I think Teresa did this because she learned that the family was Catholic, and so she kind of took that into consideration to address their spiritual needs, and she took on the responsibility of finding a priest for them to perform last rites. So she knew, or she learned how to access that spiritual resource and get that for the family to address their spiritual needs. The next one I think is important is 1G, which says all team members should have training in compassionate presence and active listening and practice these competencies as part of the interprofessional team. And I think Teresa did this again when she was talking to Al in the kitchen, and Al was expressing his frustrations, and she did a good job of actively listening and letting him feel heard. And the last one that I think is important is number 2, which says team members should have training in self-care, self-reflection, contemplative practice, and spiritual self-care. And I think the example of Teresa doing this was after Mary had passed, and she took the day not to ice skate with her family, which would serve as a distraction from what she had experienced, but she took a walk with her dog and really reflected on what she had experienced through Mary's passing away and how she helped